Welcome to the Los Angeles City Employees Retirement System Medicare Information Seminar. In this session, I'll be going over important information about Medicare and answering the most common questions from LACERS members. One thing to mention is that this seminar is geared towards retired members and their dependents. If you are an active city employee still working beyond age 65 and are covered by the city's active medical plan, you will enroll in Medicare during your retirement process. The topics that will be covered today include LACERS Medicare requirements, medical plan eligibility, senior medical plan options, and Medicare lapses. So let's begin with LACERS Medicare requirements. As stated in the LACERS board rules, when you, the LACERS member, or any dependent turn age 65, you are required to enroll in Medicare Part B and maintain coverage, and also enroll in Medicare Part A only if you are entitled to it premium-free at no cost. When to enroll in Medicare. It is recommended that you enroll in Medicare 3 months before turning age 65 and no later than 3 months after the month you turn 65. The effective date of your Medicare will be determined based on the month you applied for Medicare. Medicare enrollment effective dates are shown below. This helpful chart will show you that Medicare effective dates do depend on the part of Medicare that you're enrolling in. We'll cover more of that later. Here are the two main parts of Medicare that we'll be discussing today. Medicare Part A, that includes inpatient hospital care, hospice, and surgery. And Medicare Part B, which includes outpatient and preventative services such as office visits, X-rays, and lab tests. Medicare Part D is the Medicare prescription drug benefit, which is already included in all LACERS senior medical plans. Here's an example of a 2020 Medicare Part B premium. The monthly basic premium rate for Medicare Part B is $144.60. Premium-free Medicare Part A. If you are eligible for Medicare Part A premium-free, retired members and dependents must enroll in Medicare Part A. Here are a few ways that you may receive premium-free Part A. If you have 10 years of earnings history with Social Security outside of city employment, or if you started with the city after April 1st, 1986 by paying FICA Medicare payroll taxes, or through your spouse when they reach age 62 if they are eligible for Part A premium free. If you satisfy any of these requirements, then you would receive Part A premium free. On to the Medicare Part B reimbursement. LACERS will reimburse you for the basic Medicare Part B premium if you are enrolled in Medicare Parts A and B and enrolled in a LACERS senior plan or MPRP and receive a medical subsidy and are a city retiree. Please note that LACERS does not reimburse dependents or survivors for their Medicare Part B premium. Parts B and D, income-related monthly adjustment amounts, otherwise referred to as an IRMAA. If you are single and your modified adjusted gross income, MAGI, is more than $85,000 per year, or if you are married and file taxes jointly and your MAGI is more than $170,000, you may be charged additional premiums for Medicare's Parts B and D. The Internal Revenue Services reports your income tax for a particular tax year to CMS to determine your IRMAAs. The income tax year which determines these fees is from your tax filing 2 years ago. Because we're in the year 2020, that happens to be 2018. Remember that you are responsible for paying these additional amounts to remain eligible for your LACERS Senior Medical Plan, subsidy, and Medicare Part B reimbursement if you're eligible. Please note that LACERS does not reimburse these additional premiums. Here are ways to pay your Medicare premiums. Remember again that you are responsible for paying your Medicare premiums to Medicare directly. Medicare will bill you directly on a quarterly basis. LACERS does not process your Medicare payments, and LACERS cannot directly pay your Medicare premium from your LACERS monthly allowance. Now, if you receive a Social Security check, the premiums will be deducted from it on a monthly basis. What if you don't get a Social Security check monthly? Then consider enrolling in the Medicare Easy Pay program. What is this program? Medicare Easy Pay is a payment option for your Medicare Part B and D premiums. It will have monthly automatic electronic deductions from your savings or checking account, and it assists you in making those Medicare premium payments on time and regularly, and this is a free service. For more information, please visit the website address we've given you here. Also, please note, if you receive a Social Security check and your Medicare Part B premium is deducted from it, then you do not need to participate in Medicare Easy Pay. And here's just an example of a Medicare Easy Pay application. Let's move on to LACERS Senior Medical Plan eligibility. To be eligible to enroll in a LACERS-sponsored medical plan, you must be a city retiree or an eligible surviving spouse or domestic partner, otherwise referred to as a survivor, and you must be receiving a monthly retirement allowance or continuance from LACERS. Medicare requirements. As stated in the LACERS board rules, when you or any dependent turn age 65, you are required to enroll in Medicare Part B and maintain coverage, and again, to enroll in Medicare Part A only if you're entitled to it premium-free, meaning at no cost to you. Here are some documents that you will need to submit to LACERS. Proof of Medicare, Senior Medical Plan application, and the LACERS Senior Medical Plan application. Regarding acceptable proof of Medicare, you can provide one of the following: a Medicare card, a copy of it, a copy of a Social Security entitlement letter, or a Social Security benefit verification letter. Please be sure to provide one of these to LACERS. A question that comes up often: can I have more than one senior medical plan? No. You may only assign your Medicare to one medical plan at a time according to the Centers for Medicare and Medicaid Services. So if you did enroll in another senior medical plan other than LACERS, your LACERS medical plan will be terminated. Medicare Part D. Please be very cautious of other senior medical plan advertisements that you may receive through mail, watch on television, hear on the radio, or see on social media. Because again, if you enroll into any individual senior medical plan or prescription plan, your LACERS senior medical plan will be terminated. Okay, let's talk more about the senior medical plans. This slide shows the various senior medical plan options that are available to you. As you'll notice, if you are entitled to Medicare Parts A and B, your choices differ than if you just have Medicare Part B only. Also, please keep in mind that you must live within the plan's zip code service area. Dual care households. So what is this? Dual care households is an option when one member of the household is age 65 or older with Medicare Parts A and B, and another member of the household is under age 65 or 65 and older with Medicare Part B only. This slide shares with you the dual care household plan options. Just again to remind you, you must live within the plan's zip code service area. Let's discuss the Medical Premium Reimbursement Program, otherwise referred to as MPRP. This program is a medical plan option for retirees or survivors who reside outside of California, or maybe in California, but outside a LACERS HMO authorized zip code service area. MPRP is not available outside the US and its territories. How do you become eligible for MPRP? You must enroll in a senior medical plan, and you will be reimbursed for a Medicare Part B premium if you have Medicare Parts A and B. You'll also be reimbursed for the supplemental Medicare Part B prescription drug coverage, only if that was not part of the senior medical plan you chose, and your vision insurance premium, only if it's not already integrated into your senior plan. We bring this up because there are senior plans that will include the prescription drug coverage and the vision inside of it. Okay, regarding out-of-country medical coverage, if you plan on permanently, and again, permanently, forever, residing outside the United States and its territories, you do not need to enroll in Medicare. Retirees who reside outside of the U.S. coverage area can only enroll in Anthem Blue Cross out-of-country plan. Medicare is a federally funded program. The Center for Medicare and Medicaid Services may charge you penalties if you return to the U.S. to reside and need to re-enroll in Medicare. Contact Social Security Administration for additional details. You cannot enroll in a LACERS senior medical plan until you have re-enrolled in Medicare. So again, this is why we say if you're permanently going to reside outside of the U.S., because you wouldn't want to later come back to the U.S. and be charged penalties. Okay, let's talk about an unfortunate occurrence where Medicare payments may be missed and Medicare may lapse. If you fail to enroll into Medicare or do not pay the premium, you will no longer be eligible for a LACERS medical subsidy. Your LACERS senior medical plan coverage and that of your dependents will be terminated. The Centers for Medicare and Medicaid Services will alert your medical plan, and your medical plan will notify LACERS of your Medicare lapse. Late enrollment penalties. Nobody wants to pay late enrollment penalties. Medicare will impose a 10% premium penalty for late enrollment for each 12-month period. The penalties will exist as long as you are enrolled in Medicare Part B. LACERS does not reimburse you for these penalties. What happens if you fail to pay your Medicare Part B premiums? Your Medicare Part B will be terminated by the Center for Medicare and Medicaid Services. You and your dependents' LACERS medical plan will be terminated. You will no longer be eligible for a medical subsidy. Your Medicare Part B reimbursement will also be terminated. None of this sounds good. How do you re-enroll if Medicare Part B lapses? Contact Social Security Administration regarding your Medicare lapse and request a reinstatement. Contact the Center for Healthcare Rights at the number we've shown you here. Staff will assist you in reinstating your Medicare. Once your Medicare Part B has been reinstated, please contact LACERS immediately. The slides that follow will go over a timeline that illustrates what can and will happen during a Medicare Part B lapse that is not corrected as soon as possible. Remember, LACERS reimburses all members who have both Parts A and B of Medicare. While you must pay the premium quarterly to Medicare, you will be reimbursed monthly by LACERS. If you ever find yourself in a situation where you are unable to pay your Part B premium or have fallen behind on payments, do not simply ignore the situation. please contact Medicare or LACERS for assistance so we can avoid this lapse from happening. Okay, so let's look at this. So it's December 2019 and a LACERS member stops paying their Medicare Part B premium. Then in January, Medicare informs LACERS that the payment has lapsed. LACERS informs the member that their medical coverage has been termed as of January 1st. The member does not respond to any mailings or calls from LACERS regarding the lapse. In April of 2020, the member attempts to schedule a doctor's appointment, but is told that they no longer have current medical coverage. The member calls Medicare to reinstate Part B coverage, but the general open enrollment period is between January 1st and March 31st each year, with coverage effective on July 1. The member must now wait until January 2021 in order to re-enroll into Part B. Then in January 2021, the member re-enrolls into Medicare Part B. They are given a Medicare Part B effective date of July 2021. The member must re-enroll in the LACERS Senior Medical Plan within 30 days of the Medicare effective date. Also, failure to submit all the required documents by July 1st of 2021 may result in having to wait until January 2022 to enroll in a LACERS Senior Medical Plan. So you also may, however, have lifetime penalties imposed by Medicare. So as you can see here, this lapse will cause a lot of grief and you'll spend a fair amount of time without medical coverage. So don't let this happen to you. So how to avoid this scenario? Save yourself the stress by keeping up with your Medicare Part B premiums and by responding to all Medicare LACERS mailings promptly. If you need assistance or have questions, please contact a LACERS health advocate at lacers.health@lacers.org. For additional information from Social Security, CMS, the Center for Healthcare Rights, or the medical plans, all that information is here on this slide. And finally, to get in touch with LACERS, here's our street address. Our website is full of helpful information. Again, the email address for contacting a health advocate. And finally, we do have a YouTube channel now where you can view additional LACERS informational videos. So please follow this link to go ahead and view those helpful videos. We did cover a lot of information today. We greatly appreciate your time, and we're here to serve you. If you have any questions at all, please feel free to reach out to us. Thank you for your time.